So I'm Joel Kreisberg. I'm the executive director of the Teleosis Institute in Berkeley, California. And we work with primary care clinics on sustainability. So what that essentially means is that we consult on greening the buildings, greening the environment, greening the physicians. So our real focus is on health professionals, on nurses, doctors, and introducing the whole idea of how to be sustainable about your resources, how to get more out of less, make less waste. And so that's what I was talking about here. So I was here just to finish talking for about half an hour on how to collaborate, how to bring the sustainable process to staff in a way that's going to get everybody to buy in. The challenges are usually professionals are a bit busy, they got to do something new, what do you want from me? And so what we're usually trying to do to get over those challenges to get people to recognize that we want everybody involved, it's fun, it's easy, we're not asking you to do too much, it's really sort of participating. Well, the main benefit is that you get more from less. So we're using our resources better. So you get better outcomes, you get better community support, you get a clinic that's more embedded in the local environment. So it's a win-win for everybody, basically. Well, it kind of makes sense to me that as we're going to a more global community, and we're seeing, I mean, part of the interesting thing and why my talk was relevant is I actually sat and talked to a gentleman from the Philippines who's got a whole green initiative at his clinic, and he was talking about how it's just recently gone from what's going on in the Philippines, in the islands and the communities into the hospital, and I was like, that's about what's happening in the United States too. So I think what you're seeing is the health community is the whole globe at this stage. So I see medical tourism as just reflecting our need to be one global village. The healthcare reform bill has a big effect on primary care, which is where I work, because primary care really works with the uninsured or folks who are actually, at the bottom of the pyramid. And so, like, we're having a meeting next week over the fact that the local clinic that I'm working with is expecting about twice as many patients in the next 5 years. And so how they manage themselves is going to have a big effect. So what we're doing is supporting them and using their resources. It's been interesting. It's been fun. I didn't know much about it, so it's been interesting to see the different venues and who's doing what and meet people from all over the world. So it's great.